Through direct patient, family, and caregiver engagement, we can help all understand the how, when, and why of medication use. By offering follow-up services for our patients, we can help them avoid medication adverse events and stay adherent to critical medication therapies. Thrifty White Care Coordination grew out of our commitment to our patients and customers. We recognized transitions of care challenges and developed Thrifty White Care Coordination to help address these challenges. From admission to discharge and through continuance of care, pharmacy must help the patient and patient caregiver improve the medication experience by coordinating medication handoffs, eliminating medication discrepancies, and improving adherence. This is Thrifty White Care Coordination. Team-based care represents the most clinically effective way to address chronic disease. An available and often overlooked resource in this team-based approach is the pharmacist. Through proper coordination between long-term care facility and pharmacy, medication therapy problems, medication errors, and medication non-adherence can be significantly reduced. The goal of Thrifty White Care Coordination is to reduce the total cost of care for patients residing in long-term care communities, reduce hospital readmissions during a long-term care stay, and increase patient and caregivers' general understanding of why to take, when to take, and how to take medications. The first part of Thrifty White Care Coordination is the Prospective Medication Review, or PMR. The PMR is when a pharmacist reviews medication orders prior to or at the time of patient admission to a long-term care community to advise the admitting community of potential medication therapy concerns. This PMR is designed to identify medication issues that may be specific to a community's individual practice setting. The process starts when a community decides to admit a patient. They then notify the pharmacy and send the medication information. Next, the pharmacy communicates back to the community any potential medication-related issues for follow-up. After completion of follow-up, outcomes are documented for further evaluation. The review will include the identification of drug therapy problems such as therapeutic duplication, drug-disease contraindications, drug-drug interactions, drug allergy interactions, order completeness, cost containment solutions. The PMR is a cost-effective tool for all patients being admitted to a long-term care community. The next part of Thrifty White Care Coordination is medication therapy management. Thrifty White Pharmacy recognizes the importance of comprehensive medication management and the vital role it has in reducing medication-related problems. Studies have documented that for every $1 spent on medication therapy management, up to $12 is saved in total healthcare costs. By avoiding potentially significant medication adverse events, patient transfers are reduced, community occupancy remains stable, and patient outcomes are improved. A comprehensive medication review, or CMR, is an interactive person-to-person consultation designed to improve patient and caregiver knowledge of medications, address medication problems, and empower the patient and caregiver around medication use. This is a valuable tool for patients and communities to help patients age in place, particularly for patients in the independent living and assisted living community setting. Thrifty White consultant pharmacists are specialists in senior care pharmacy. 76% of recommendations made by consultant pharmacists are implemented by prescribers. Consulting is the next step in Thrifty White Care Coordination. A consultant pharmacist is a medication therapy management expert who provides advice on all aspects of medication use, such as advice on the proper handling, storage, and security of medications, as well as best practice recommendations on medication use to patients and caregivers. Consulting pharmacists can assist in the development of medication policies and procedures, collaborative practice agreements, and formularies. They assist with regulatory compliance, are members of the Quality Assurance Committee, and can provide and organize staff educational events. Our consulting team has the capability to provide consulting services to all long-term care communities. The last part of Thrifty White Care Coordination is our Discharge Medication Coordination. Its initiative is designed to improve medication management for patients being discharged back home from a long-term care community. The initiative includes medication reconciliation and patient education at discharge, patient satisfaction survey, Thrifty White follow-up phone calls at 3 days and 3 weeks after discharge to identify potential problems, track hospital readmissions, and help coordinate medication refills. Here's a sample video of what a discharge counseling session looks like.
Did you have recent surgery?
I did. I had a hip replacement.
Hip replacement, okay. How comfortable are you right now with all of your medications, taking them?
I'm okay with it. Some of them are a lot larger than the ones I had at home.
So we're going to talk about your meds first, go through your med list, see if you have any questions, and then we'll discuss what meds you may need at home. Going through your med list, it looks like, are you still taking a multivitamin once daily?
Yes.
Okay, how has your blood pressure been?
It's been a little higher here than it is normally when I go to my doctor at home, but I think it's, this is kind of an anxious place to be.
So yeah, next visit, just, get your blood pressure checked, see if it's gone down a little bit, but if it's being, within normal range, just keep getting it checked at the doctor's visit. And it looks like gabapentin. Have you been taking that for a while?
Yeah, that was supposed to be for fibromyalgia, I thought.
Okay, and do you take that 3 times daily?
Yes.
Okay, and has that been treating the fibromyalgia and the pain?
Yes.
Has been effective? Okay. So we went through all your medications. Did you have any questions on any of them?
No, except for the 2 I asked you about.
Yeah. Okay, and then what medications did you need from us for a 30-day supply, Norma?
Well, probably all these that we went through.
Okay, so all of them then, the multivitamin and calcium, vitamin D, too. So, yeah, any other questions, just give us a call, and thanks, Norma, for your time.
Thank you.
Yeah, bye.
Bye.
Did you find this helpful? Did you learn anything about your meds, or did you find it helpful to go over with someone?
Yeah, I think this is a good thing.
Thrifty White Pharmacy believes we can reduce hospital readmissions by improving medication management and by engaging the patient and staff through discharge counseling and follow-up services. Additional services offered through our Discharge Coordination Initiative include delivery of a 30-day supply of discharge medications prior to leaving the community, enrollment in our RX MedSync program, which studies have proven to increase adherence, additional packaging systems of choice shown to complement medication synchronization and further improve adherence. Please continue to watch additional videos available on Thrifty White Care Coordination at www.thriftywhite.com. Also, please feel free to contact us with questions using any of the contact methods listed on the screen.